Is it now a time to promote vaccines, which again, the CDC says safe, effective, that 2 doses are 90% effective against measles? Is it now a time to promote that, especially among children who are being impacted by measles in places like Texas and in these 6 states who are unvaccinated, according to health officials?
Pamela, with respect, why aren't you asking me about the fact that 50% of teens have obesity? Why aren't there are breathless
I have other
segments
questions
being run
for you,
on
but we're
CNN
talking
Climate
about this.
Day after day after day, Pamela. It's breathless coverage of 5 measles cases. Why aren't we asking why 16% of COVID deaths worldwide were Americans when we're only 4% of the world population? Because the CDC said our immune system. No, it is related, Pamela, and let me say why. Because the entire coverage of Bobby Kennedy is around measles. The Democrats said the word measles 25 times in the first hearing and said the words obesity, diabetes, and chronic disease 0 times. The HHS priority document under President Biden said the word equity 25 times, said the word vaccines countless times, did not say the word obesity or diabetes. There is a problem right now because this is not zero. This is zero sum. We are focused on a very small subset that's important. We need good infectious disease management. Bobby Kennedy, Dr. Offit is not correct. Bobby Kennedy has said one thing about vaccines and one thing only, that they should be studied like any other product. Dr. Offit on the ACIP committee has recommended vaccines that have ended up being recalled for causing mass issues to kids. Bobby Kennedy has written multiple books, not about being anti-vax, but about having good science. And Dr. Offit is calling him anti-vaccine for literally just saying we need studies. Bobby Kennedy is not concerned with measles. He wants good policies with measles. He wants to attack the 92% of deaths in the United States, which is chronic conditions.